In today's session, we'll be talking about the second part of the physiology of the arterial blood pressure. Our learning objectives is to explain the regulation of the arterial blood pressure and explain what could be the clinical application of today's lecture. The regulation of the arterial blood pressure is done through three mechanisms. Short, rapid mechanism, which is potent, very rapid, starts within seconds, reach the maximum within minutes, and it's maintained for few hours. It's a neural mechanism where we have reflexes. The component of the reflex, we need to have receptors. We have different receptors: Atria receptor, chemoreceptor, and Burroreceptors. Then we have the center, which is the cardiac center. Then we have effector organs. These effector organs, mainly the cardiovascular system in the form of the heart and the blood vessels. Then we have delayed mechanism, which is the hormonal mechanism. It controls the arterial blood pressure indirectly by controlling the blood volume. Although it is a long-term and delayed mechanism, yet it divided into intermediate delay, where we have the Reninangiotensinaldosterone system, and we have the late delay, where we have the antidiuretic hormone and the Atria natriuretic peptide. In between the short-term mechanism and the delayed mechanism, we have an intermediate mechanism. This intermediate mechanism is done through the capillary fluid shift. Starting with the short-term regulation, which is the neural regulation. We said it's neural regulation, very rapid. We have reflexes. What do you mean by a reflex? The important component that we need to have receptor, center, effector organ. The receptor will have Burroreceptor, atrial stretch receptor, chemoreceptors, and also proprioceptors. Also, the cardiac center has the ability to receive impulses from higher center, the cerebral cortex, the limbic system, and the hypothalamus. These receptors will send information about the arterial blood pressure to the cardiac center, which is present in the medullary region, referring back to what we took earlier about the cardiac center, the cardiac acceleratory center, the cardiac inhibitory center, the vasomotor center. According to the information that came to the cardiac center from the receptor, the response is either to increase the arterial blood pressure by activation of the cardiac acceleratory center, which will lead to increase in the heart rate and the contractility, and stimulation of the vasomotor center, which will lead to vasoconstriction of the blood vessels. So if we're increasing the heart rate and the contractility and producing vasoconstriction, we're increasing both the factors that affect the arterial blood pressure, which are the cardiac output and the total peripheral resistance. Sometimes we need to decrease the arterial blood pressure as a response to the stimulus that came from the receptor. This is done by stimulation of the vagus that will decrease the heart rate. Kindly note that the vasomotor center sends constant sympathetic discharge to maintain the partial contraction of the blood vessel. This is what is known as the sympathetic tone. The impulses from the cerebral cortex, hypothalamus, and the limbic lobe also influence the sympathetic system. Kindly revise the role of the vasomotor center. Now we will talk about the role of the Burroreceptor in the regulation of the arterial blood pressure. The Burroreceptor are present in the carotid sinus and the aortic arch. They detect minute-to-minute changes in the arterial blood pressure rather than the stationary pressure. They have the ability to reset their setting point if the arterial blood pressure is kept elevated for a long time, more than 1 or 2 days. They adapt to this increase in the mean arterial blood pressure when it exceeds 150 millimeter mercury, or the systolic blood pressure become more than 180 millimercury, and consider that this is a new setting point and this is the normal, and they stop reacting to it. What happens if the arterial blood pressure is raised? If the arterial blood pressure is raised or high, this is detected by the baroreceptor present in the carotid sinus and the aortic arch. This will lead to a response in order to decrease the arterial blood pressure. So there will be stimulation of the cardiac inhibitory center, inhibition of the cardiac acceleratory center, and inhibition of the vasomotor center, which will lead to decrease in the heart rate, the contractility of the heart, and increase in the diameter, which means decrease in the total peripheral resistance. These effects combined together will lead to lowering of the arterial blood pressure, which will remove the trigger that was elevation of the arterial blood pressure. So again, an increase in the arterial blood pressure is detected by the arterial baroreceptor, carotid sinus, and the aortic arch. They start firing in order to remove the trigger, which is high blood pressure. They inhibit the cardiac acceleratory center and the vasomotor center, and they stimulate the cardiac inhibitory center, which means there is decrease in the sympathetic outflow to the heart, the arterioles, and the vein, and there is increase in the parasympathetic outflow to the heart. For more details, an increase in the arterial blood pressure is detected by the baroreceptor, carotid sinus, and the aortic arch, supplied by the glossopharyngeal and the vagus nerve. Both of them are known as the buffer nerves. They send impulses to the nucleus tractus solitarius in the medulla, leading to activation of the cardiac deceleratory center, which is the cardiac inhibitory center, and inhibition of the cardiac acceleratory center and the vasomotor center. The end effect of this is to correct the trigger, which was increase in the arterial blood pressure. So there is decrease in arterial blood pressure through decreasing the heart rate, the contractility, and the total peripheral resistance, which these are the factors that affect the arterial blood pressure. If the arterial blood pressure is decreased, there is decrease in the stretch of the carotid sinus and the baroreceptor, decrease the firing rate at the level of the baroreceptor. This will lead to decrease in the parasympathetic activity of the heart and increase in the sympathetic activity of the heart and the blood vessel. These two together will lead to increase in the heart rate, increase in the contractility, vasoconstriction, which will lead to increase in total peripheral resistance, and the end effect of this is to increase the arterial blood pressure. By this, we're removing the trigger, which was drop in the arterial blood pressure. To summarize this, the baroreceptor plays an important role in maintaining a homeostatic state of the mean arterial blood pressure. They respond to the change in the arterial blood pressure rather than the stationary elevation of the arterial blood pressure. If the arterial blood pressure is increased, the baroreceptor will fire impulses to the cardiac inhibitory center to be stimulated, to inhibit the cardiac acceleratory center, to inhibit the vasomotor center. The end effect of this is to decrease the cardiac output and produce vasodilatation. Decreasing the cardiac output and decreasing the total peripheral resistance will lead to drop of the arterial blood pressure, thus removing the trigger, which was increasing the arterial blood pressure, and we return back to the homeostatic state. The opposite is true when there is decrease in the arterial blood pressure. The response is to increase the arterial blood pressure by increasing the cardiac output and the total peripheral resistance through stimulation of the cardiac acceleratory center and vasomotor center and inhibition of the cardiac inhibitory center. What is the role of chemoreceptor in the regulation of the arterial blood pressure? Chemoreceptors are present in the carotid sinus and the aortic arch. They are supplied by the buffer nerves. They are stimulated by changes in the partial pressure of oxygen, partial pressure of carbon dioxide, hydrogen ion concentration, the pH of the blood. We have two types of chemoreceptor, central chemoreceptor. We will not discuss them now. Our discussion will include the peripheral chemoreceptor. The main stimulus is the hypoxia, followed by the increase in the partial pressure of carbon dioxide and increase in the hydrogen ion concentration, which is a state of acidosis. For the chemoreceptor to be stimulated, with the accumulation of these metabolic waste product and the state of hypoxia, the arterial blood pressure needs to be dropped to a dramatic level, to a critical level around 60 millimeter mercury. When the chemoreceptor are stimulated, they send impulses to the vasomotor center to produce vasoconstriction, increase total peripheral resistance, thus leading to increase in the arterial blood pressure. That will correct the trigger, which was critical decrease in the arterial blood pressure around 60 millimeter mercury. So it's important to know that this reflex is not a powerful controller of a normal range of arterial blood pressure. It does not act except at a low level of arterial blood pressure. To summarize the role of the chemoreceptor in the regulation of the arterial blood pressure, we have a homeostatic state where we have a normal partial pressure of oxygen and carbon dioxide and pH of the blood. In severe drop of the arterial blood pressure around 60 millimeter mercury, the blood supply to the tissue will be less, leading to hypoxia, decrease in the partial pressure of oxygen, increase in the carbon dioxide level, in the hydrogen ion level, and it's a state of acidosis. This will be detected by the peripheral chemoreceptor in the carotid sinus and the aortic arch. They will send impulses to the cardiac center and the respiratory center. For the cardiac center, the aim is to elevate the arterial blood pressure. So there is stimulation of the cardiac acceleratory center and vasomotor center and inhibition of the cardiac inhibitory center. The end effect of this is to increase the cardiac output and increase the total peripheral resistance. For the respiratory center, the response will be increase in the rate of breathing. So both the effect, increase in the respiratory rate and increase in the cardiac output, increase in the total peripheral resistance, increase in the arterial blood pressure, will lead to increase in the oxygen, pH of the blood, decrease in the carbon dioxide level. This will correct the homeostatic state and it is restored back to the normal level. Remember that the chemoreceptor in the carotid and the aortic bodies monitor the level of partial pressure of oxygen, partial pressure of carbon dioxide, the pH of the blood. We have two types of chemoreceptor, central chemoreceptor present in the medulla. We will not discuss them now. We'll discuss them with the respiratory system, and the main stimulus for them is the change in the hydrogen ion concentration and carbon dioxide level. The peripheral chemoreceptor present in the carotid sinus and the aortic arch, the main stimulus for them is the hypoxia. When they are stimulated, they will lead to increase in the arterial blood pressure by activation of the cardiac acceleratory center, the vasomotor center, inhibition of the cardiac inhibitory center, and at the same time they will send impulses to the respiratory center to increase the respiratory rate. The end effect of this is to correct the state of hypoxia, hypercapnia, acidosis, and return back to the homeostatic state. What is the effect of atria stretch receptor on the regulation of the arterial blood pressure? Atria stretch receptor are receptors present in the wall of the right atrium. They detect the changes in the blood volume more than the changes in the blood pressure. If there is increase in the volume of the blood, which is accompanied by increased venous return, increase in the arterial blood pressure, the wall of the atrium will be stretched. There is stimulation of the atrial stretch receptor. This will lead to increase in the heart rate by the Bain-Bridge reflex, inhibition of the vasomotor center, which will lead to vasodilatation and decrease in the total peripheral resistance and decrease in the arterial blood pressure. Also, the vasodilatation is at the level of the glomerular blood vessels, which will lead to increase in the blood flow. So it's accompanied by increase in the glomerular filtration and increase in the urine formation. Also, there is inhibition of the hormones that preserve the water in the body. So there is inhibition of the antidiuretic hormone and the aldosterone hormone. Thus, when you look at the effect on the glomerular filtration rate and the effect by the inhibition of antidiuretic hormone and the aldosterone hormone, these two effects will lead to excess urine formation. When there is excess urine formation, there is decrease in the blood volume, so we are removing the trigger that stimulated the atrial stretch receptor, which was increase in the blood volume. Also, the atrial stretch receptor, when they are stimulated, they will lead to release of the atrial natriuretic peptide. This atrial natriuretic peptide has a natriuretic effect, which means getting rid of the sodium in the urine, and whenever the sodium is moving, water is moving after it, so the atrial natriuretic peptide will have a natriuretic effect and diuretic effect. Now we'll be talking about the intermediate mechanism in the regulation of arterial blood pressure, which is the capillary fluid shift. It starts to act within few minutes and reach the full function within few hours. Any changes in the arterial blood pressure is reflected as a change on the capillary hydrostatic pressure. So if the arterial blood pressure is increased, the capillary hydrostatic pressure is increased, which is an important filtrating force that will filter the blood from the capillary side to the interstitial space, decreasing the blood volume, thus decreasing the blood pressure and removing the trigger, which was increase in the arterial blood pressure. Since the regulation of the arterial blood pressure in this mechanism is done by moving the blood or the fluid from the blood side to the interstitial space, that's why it is called capillary fluid shift. Now we'll be talking about the long-term regulation, which is the hormonal regulation of the arterial blood pressure. It's a delayed mechanism. Although it is delayed, it's divided into intermediate, which is the renin-angiotensin-aldosterone system, and late delayed, which is the antidiuretic hormone and the atrial natriuretic peptide. To describe the renin-angiotensin-aldosterone system, it starts with decrease in the arterial blood pressure, which is accompanied by decrease in the renal blood flow, detected by the juxtaglomerular apparatus. This will lead to release of the renin. The renin will convert angiotensinogen coming from the liver to angiotensin 1. Then angiotensin 1 will be converted by angiotensin converting enzyme coming from the lung to angiotensin 2. Angiotensin 2 is the key substance, our golden substance, that has the ability to increase the sympathetic activity, which means increase the heart rate, increase the stroke volume, increase the cardiac output, thus increasing the arterial blood pressure. Angiotensin 2 can act directly on the renal tubule, leading to sodium reabsorption, potassium secretion. Whenever we have sodium reabsorption, the water will follow, so we will have water retention. This will increase the blood volume, increase the cardiac output. Angiotensin 2 also can stimulate the adrenal cortex to secrete the aldosterone. Aldosterone hormone will act on the renal tubule, producing sodium reabsorption, potassium secretion, and water retention. Angiotensin 2 has a direct vasoconstrictor effect on the blood vessels, leading to increase in the total peripheral resistance, thus increasing the blood pressure. Angiotensin 2 can stimulate the posterior pituitary to secrete the antidiuretic hormone, which act on the collecting duct, leading to water reabsorption and retention of the water. So by all of this, we are increasing the two important factors that affect the arterial blood pressure, which are the cardiac output and the total peripheral resistance. That's why we will correct the trigger, which was the drop in the arterial blood pressure. What is the role of the antidiuretic hormone and the regulation of the arterial blood pressure? The antidiuretic hormone, or another name for it, the vasopressin, is a hormone secreted from the posterior pituitary. The trigger will be hyperosmolarity, angiotensin 2, sympathetic stimulation, decrease in the atrial receptor firing. This will stimulate the posterior pituitary to release the vasopressin, which is the antidiuretic hormone. The vasopressin will act on two levels. The first level at the level of the blood vessel through V1 receptor, which will lead to vasoconstriction, thus increasing the total peripheral resistance, which will increase the arterial blood pressure. The other level that the vasopressin act on, the renal tubule, through V2 receptor. This will lead to water reabsorption, water retention, thus increasing the blood volume, increasing the cardiac output. By this, the vasopressin has the ability to increase both the factors that affect the arterial blood pressure, which are the cardiac output and the total peripheral resistance. What is the role of the atrial natriuretic peptide in the regulation of the arterial blood pressure? The atrial natriuretic peptide released when there is overstretch of the atrial stretch receptor, which occur when there is increase in the blood volume and venous return and the increase in the arterial blood pressure. The atrial natriuretic peptide is released, leading to natriuresis, loss of sodium in the urine, which is accompanied by loss of water, which is diuresis. The natriuresis and diuresis will correct the trigger, which was increase in the blood volume, and will correct the other trigger, which was increase in the arterial blood pressure, because if we are getting rid of the sodium and the water, we will have a decrease in the arterial blood pressure. When you look at the effect of the atrial natriuretic peptide, which is natriuresis and diuresis, you'll find that this hormone opposes the action of Reninangiotensinaldosterone system, which was salt and water retention. What is the role of the adrenal medullary hormones in the regulation of the arterial blood pressure? The adrenal medullary hormones are secreted during the period of the stress. These hormones are the norepinephrine and the epinephrine. Both hormones enhance the sympathetic fight or flight response. You have to remember that the norepinephrine has a vasoconstrictor effect. The epinephrine will increase the cardiac output and promote the generalized vasoconstriction. What could be the clinical application of today's lecture? The first clinical application of today's lecture is the CNS ischemic response. When the cerebral blood flow is reduced in cases of severe hypotension, when the blood pressure is below 50 mm mercury, this is accompanied by ischemia, which will stimulate the cardiovascular center to produce generalized vasoconstriction and tachycardia to increase the arterial blood pressure up to 200 mm mercury. This response is very important in the emergency as a defense mechanism, as it acts rapidly and extremely powerful to increase the arterial blood pressure when it falls enough to endanger life. But in a normal condition, it's not one of the normal mechanisms in regulating a normal arterial blood pressure. It only works when there is severe hypotension, when the arterial blood pressure drops below 50 mm mercury. Then another clinical application, which is Caution reflex. What is this Caution reflex? When there is increase in the intracranial pressure, just in case of brain tumor, the intracranial pressure could increase more than the 30 or 33 mm mercury. What is the normal intracranial pressure? The normal is around 11 mm mercury. So when there is increase in the intracranial pressure in cases of tumor, the cerebral blood flow will be reduced because it's considered as a state of cerebral ischemia. As a result of this ischemia, there is stimulation of the cardiovascular center, leading to increase in the arterial blood pressure. The increase in the arterial blood pressure is the force that will maintain a proper cerebral blood flow. Another clinical application of today's lecture is the carotid sinus syndrome. It's a sudden temporary loss of consciousness due to stimulation of hypersensitive baroreceptor in the carotid sinus. Also, one of the clinical applications of today's lecture is the hypertension. What is hypertension? Hypertension is defined physiologically as a condition of sustained elevation of the arterial blood pressure at the level of 140/90 mm mercury or higher. It's important to know that about 90% of the hypertensive people, they have primary or essential hypertension in which the underlying cause is not identified. 10% of the cases are secondary hypertension due to known cause or disorders such as obstruction of the renal arteries, kidney disease, atherosclerosis, or endocrine disorder. Also, one of the most important and fundamental clinical application of the physiology lecture related to the arterial blood pressure is to be able to come up with a management plan of a hypertensive case. When we say management plan, it's not only related to the drugs, but it's a whole plan. Number one, proper diet to reduce the weight. Reducing the weight will decrease the length of the blood vessel, decrease the total peripheral resistance, decrease the arterial blood pressure. Regular exercise also reduce the weight and produce the same effect, improve the mental state and lead to relaxation, improve the cardiac efficiency. At the level of the drugs, at the level of the CNS, we can give beta blocker and alpha-2 agonist. At the level of the blood vessel, we can give alpha-1 receptor blocker, calcium channel blocker, vasodilator, angiotensin 1 receptor antagonist, or angiotensin converting enzyme inhibitor. At the level of the kidney, we give diuretics, beta blocker, angiotensin converting enzyme inhibitor. At the level of the heart, we can give beta blocker. This is the principle of the management of a case of hypertension. What we're doing is opposing all the factors that may lead to increase in the total peripheral resistance or increase in the cardiac output. When we are blocking them, this means we are reducing the total peripheral resistance or controlling and regulating the cardiac output, thus controlling and regulating the arterial blood pressure. Just remember that all the mechanism, the short-term mechanism, the intermediate mechanism, the long-term mechanism, the aim of them is to maintain the homeostasis of the blood pressure within the normal range. By this, we finished the regulation of the arterial blood pressure and the physiology of arterial blood pressure. Hope you enjoyed the lecture. Thank you.